Okay, thank you, Dr. Lopez, for introduction, and I would like to congratulate the previous speaker for the wonderful presentation. And I would like to say that in behalf of my cluster here in WHO Afro, to express our gratitude for this opportunity to participate in this webinar. But first of all, I would like to say that as all of us know that non-communicable disease in general is public health problem because the number of people living with NCDs are too high, and NCDs represent 74% of all deaths worldwide. And these NCDs, as we are participating in this webinar, we know that are not only affecting adults, because NCD is affecting children. And in general, the main NCDs are cardiovascular disease, cancer, chronic respiratory disease, and diabetes. And here in Africa, we have a Brazzaville Declaration, and Brazzaville Declaration includes all the diseases like sickle cell disease, oral health, higher ear health, and injuries. But in some countries, they recognize the kidney disease as a public health problem, and they are including kidney disease in the program. As I was saying, that NCDs are public health problem not only affecting adults but children too. For example, according the last reports on prevalence of NCDs in children, the reports estimate that more than 2 billion of children are affected annually by non-communicable disease, and one of the non-communicable diseases affecting children is a chronic kidney disease. And WHO and Unite in general, they established some strategies, some planning to deal with or to reduce the burden of NCDs. And this strategy basically are reducing the risk factor or reducing the exposure of risk factor, screening, early detection, and treatment. But unfortunately, we have to recognize that the majority of NCDs are happening in developing countries. And in these countries, we have a big inequities related, for example, the lack of facilities, we have a lack of trained health worker, we have a lack of access of medicine and health technology. And to address this disease, WHO have the role to support the country in developing policies, in developing evidence, and supporting country to implement this strategy. And we think that this strategy could help to reduce the magnitudes or the burden of NCDs in developing countries. And as Dr. Erickson presented, if we analyze his presentation, the majority of low or developing countries, they have these challenges, and it's very difficult to address any disease, specifically chronic kidney disease. And let's take, for example, kidney disease. If we analyze the data in the African country or in some country of Asia, when the patient come to the hospital, they are in advanced stage. And even when they come to the hospital, as the doctor showed in his presentation, we have problem of medicine technology. In case specifically of kidney disease, we have problem with replacement treatment for the kidney. That's why WHO, in his role, he need to work with international organizations, as for example IPNA. We think that IPNA is an important organization that can establish partnership with WHO, because WHO has this power to elaborate and establish recommendations for the country. For example, now we have a partnership with NCDI Poverty Network, we are implementing, for example, Pen Plus, that is approach that take care of patient with cardiovascular disease and diabetes 1 and sickle disease in severe condition to treat them. And for example, in the case of kidney disease, we need, for example, to develop a guideline, for example, how to, to, to manage NCDs in second level. I think in this perspective, our partnership is important too. In general, I would like to say that socio-economic index is, in our point of view, is an important aspect that contributes to the burden of disease in developing country. And to work to reduce this burden, it is important to establish this partnership with NGOs, with international and national organizations, but because we think that only working together that we can reduce this problem that we are facing in developing country. I think that IPNA is an important partner because you are doing a very good job training health workers, delivering, for example, the study that you carried out is very important because we have a very good data. I think that this partnership is very important. I think that is all that I have to say now. I will be available for questions. Thank you.